Greeting from ECS Heart. I'm Dr. Ahmed El Kamaly, pediatric cardiologist. Today I would like to talk about heart murmur in babies or in children. I think that this is one of the important topics and one of the important symptoms that the primary healthcare physicians and also the pediatrician will face it in their clinic and in their daily work. As we know, the heart murmur is one of the alerting signs that can give us an indication to do further investigation for the heart problems in the baby, for the congenital heart. Just to give a brief, heart murmur is not always like a pathological murmur. We know that there is a part of the murmur will be an innocent heart murmur and part of them will be a pathologic murmur. But to educate our colleague in the primary healthcare and the pediatrician, if anyone faces a baby with a heart murmur, he should find or he should look to the other symptoms and signs that can suggest heart problems. Mostly if there's any dysmorphic feature in the baby, if he's not doing well, he's not thriving well, he's not gaining weight, if there's any other symptoms with a murmur like cyanosis, blood pressure change, pulse volume is big or is wide, all these symptoms and features and signs should be found before you refer him to the pediatric cardiologist. When we refer the baby or the child with a heart murmur, we feel that there is secondary symptoms and signs. As I mentioned, when you saw the child with a dysmorphic feature or he's not gaining weight or he's having any other symptoms, you have to refer him to the pediatric cardiologist. Of course, if the baby presents to you in heart failure symptoms or he came with cyanosis, this is an urgent referral. You have to refer him immediately to the pediatric cardiology in any hospital around you, and then they will take care. Or you have to call the pediatric cardiologist that you know them and refer him immediately. But please take a heart murmur as an important sign and important finding that from there you will go ahead to do further evaluation to find this murmur is coming from a pathological heart problems or it's an innocence murmur. Thank you.